Namaskar. Today I will be busting the pregnancy myths. So let's begin our video. There are many myths present in our society during pregnancy. So the first timers found it very much difficult to cope up with these myths. So it's important to bust those myths. So let's begin our video. If you like my video, found it interesting, please do subscribe to my channel, Mom's Guidebook. So let's begin our video. The first prevalent myth which is there in the society is that of first trimester. When the woman experiences a bleeding during the first trimester may result in miscarriage. It's completely wrong to say that each bleeding may result in miscarriage. Some women, about 30 to 40% women, experience implantational bleeding. That is the bleeding that happens when the fetus get attached to the uterus wall to get the required supplements, food and energy. So in this process also some bleeding happens. So it's important for you to get it checked by the gynae to assure that it was an implantational bleeding or a miscarriage. The second myth is eating for two. The prevalent notion is that the woman who is pregnant should eat more than her diet and equal to two people's diet. It's a completely wrong notion. Putting lots of calorie unnecessarily will increase your weight and cause difficulty in delivery time. So it's important to eat precautiously. During the first trimester, experts suggest that there is no need to increase your calorie. During the second trimester, it's important to increase your calorie up to 340 calorie per day apart from your diet. For the third trimester, it is suggested to eat 450 calorie per day apart from your regular meal. The third myth is you should not exercise while you are pregnant. It's a completely wrong notion. Unless and until the doctor has suggested you for a bed rest, you can actively work and exercise in your daily life. You can have a light yoga in your first trimester, or you can have a light aerobics for about 2 to 5 days in a week as per the guidance of a trainer. Next misconception is that the woman should rest throughout her journey. It's a completely wrong notion. Unless and until you are suggested for a bed rest, you should work actively like your normal days. Next is pregnant ladies should not go for ultrasound as its harmful rays will affect the baby. But it is completely wrong because these ultrasound waves does not harm your child. Apart from that, it gives a detailed picture of your kid's health. So monitoring the kid's health is more important. So for this, ultrasound is important. And if you want to have any information regarding ultrasound during the pregnancy, I have made a dedicated video on this. You can watch it. The next is you should avoid having iron supplements during the pregnancy, as these iron pills may darken your baby's skin. It's completely wrong notion again, because giving iron to your baby which increase the hemoglobin level and health of you and your baby. In fact, not having the iron pills may result in miscarriages. Next is the pregnant lady should not go for vaccination. It's again a completely wrong notion, because during the pregnancy in the first trimester itself, doctor gives 2 vaccines, first for the flu shot and the second one for the tetanus. The next and most common misconception is that breastfeeding comes out naturally. It's not that naturally. Once a kid comes in your arms, you will start breastfeeding. It's not that the case. You need to learn the position and the latching conditions, how to do the things. So some time is needed for the mother and the baby to settle down for the breastfeeding. So it's not that natural. So these were the myths that I busted about the pregnancy. If you liked my video, found it interesting, please do subscribe for more pregnancy videos. Here Bhavya signing off.